It's now my pleasure to introduce our distinguished speaker, Aneesh Chopra, the Chief Technology Officer of the United States and the first person to hold this position. Aneesh also serves as Assistant to the President and Associate Director for Technology within the Office of Science and Technology Policy.
I must say, first of all, thank you to the Commonwealth Club for having me, and a specific thank you to Sam, who has been an incredible partner in this journey of ensuring we get the standards right so that we can enroll those individuals in a manner that is befitting our 21st century approach to the public sector. I want to say at the outset that the opportunities and the challenges before us are both exciting and real. We have challenges, but we have opportunities that will overcome them. And my ambitions today are really threefold: to provide a framework for all of you in understanding how the Obama administration is thinking about the intersection of healthcare and technology. Number two, to have specific action items that might allow for you to participate in this journey. And three, perhaps most importantly, if Tom does his job, that we get good questions from the audience, that I can listen to the concerns that are on your mind so I can take back to Washington areas of opportunity for us to improve. We also acknowledge the importance of advanced information technology infrastructures. And there's no IT infrastructure more relevant to healthcare, in my humble opinion, than our commitment to a mobile broadband revolution. It's just happening in ways we couldn't even imagine. In February, I had the pleasure of celebrating an open collaboration called Text for Baby. Again, at zero cost to the American taxpayer. We launched a service that basically had a very basic proposition. If you're pregnant and you want relevant information to keep yourself healthy through pregnancy and over the first year of the child's birth, text 511411, your due date, and you will receive 3 relevant messages a week, free of charge. This collaboration got the cell phone companies to waive their fees, got the content companies to offer their data, got the Centers for Disease Control to say, let's take a look to make sure these messages adhere to best practice. And already, in less than 6 months, over 60,000 people have signed up for this service. Not a nickel of taxpayer dollars. Simple, easy ideas. What more might we see come out of our wireless health revolution? We understand, to get this right, we also have to address the regulatory challenges. The FCC has jurisdiction over wireless technologies. The Food and Drug Administration has jurisdiction over our healthcare system. How might we establish a framework to ensure that we are getting that balance correct, addressing the need to facilitate innovation while absolutely protecting patients? That's why I was so pleased that Dr. Hamburg at the FDA and Chairman Janikowski at the FCC established a joint statement of principles that was released to the public in just the end of July, a few weeks ago. It's also about research and development infrastructure as a key enabler of innovation. We believe our nation's universities continue to be engines of new products and services that will transform our healthcare system. We've just got to do a better job of tapping into that ecosystem. I didn't have the chance to visit yesterday Stanford's biodesign program, but I visited one of the startup companies that came out of biodesign, and that was the story of iRhythm Technologies, a little nimble entrepreneurial startup that came out of Stanford that had a very basic proposition. You could see the picture of the gentleman on the left of that graphic that had a traditional Holter monitor to address their cardiac arrhythmia, to monitor their heart rhythm. Yet to the right, you can see the innovation that iRhythm had established that created a simple wearable patch that for 2 weeks could capture the data necessary to identify if in fact you had an arrhythmia problem. What's really powerful about this case study is the reimbursement cost to the healthcare system is the same for both products. In other words, iRhythm innovated a perceivably better product at existing to lower cost. It is that intersection of what I would refer to as affordable engineering that we're going to see more and more of as we look to the intersection of these devices. That's why the Commerce Department initiated a competition called the I6 Challenge to look for how universities can commercialize innovations out of their campuses and into their local ecosystems by rewarding 6 communities that have demonstrated a new and creative approach to take those ideas and commercialize them to market. However, I would be remiss if I ended my remarks without describing the purpose of my remarks for you today. That is not just to lecture you on public policy, but to seek your support and engagement as we look to commercialize these ideas and to deliver them patient by patient, community by community. It's why we celebrate the fact that we have in the audience today several of our ecosystem partners who said we will stand up, not because there's a government law or a government grant, but because we believe this country needs to see innovations that intersect at healthcare and technology. That's why we have our friends and partners at the Health 2.0 community, Indu and Matt, who are sitting with us today, who have convened the Health 2.0 Developer Challenge, a simple platform that is inviting catalysts from nonprofit, for-profit, academic resources to leverage the platform and ask the question, how might we at the grassroots level spur breakthroughs and innovations powered by government data, if possible, powered by policy areas of interest that I've just described, any and all of the above. And I'm so pleased to announce today that one of the early adopters on this Health 2.0 Developer Challenge is with us today. Where's my man, Don? Give a shout out to my man, Don Casey, in the back. Don is with us from West Wireless Health Institute, who's committed to driving innovations in healthcare focused on wireless applications that drive down costs and improve quality. West Wireless has announced a $10,000 prize for a personalized wireless health ecosystem. And they're not alone. The Markle Foundation announced, as I said earlier, that Blue Button program the President announced for the Veterans Administration. Markle said you get to have lunch with Clay Shirky if you could develop an application that can read that flat file and find a way to bring more life to that data to improve our veterans' care, and not just the veterans, but others who might replicate this model. Challenges big and small are available at the health2challenge.org website. I implore all of you, join the community of innovators, participate in this program, encourage and celebrate new ideas that we should take beyond the current slate of initiatives. I will be back in October to stand alongside the best and the brightest in this innovation ecosystem to celebrate those ideas that have come to the top from this early adoption, this early round of innovation challenges that we've seen. That's what we're here to say. We've got a policy framework, we've got grassroots activities. We hope we've gotten this right, and if we haven't, we will course correct with your feedback. Thank you for indulging me this afternoon.
That's great. There's some questions about how providers can play a role as entrepreneurs in terms of, you mentioned one of those in your remarks about a physician saying, how can I easily transfer records? Yes. But is there a way that providers that come up with ideas can play a role in creating these new models of health information exchange or models of care or use of technology in their practices and make sure they're shared?
3 ideas. Number 1, everyone who cares to innovate in this space should visit health2challenge.org. You will find at least one or more inspiring challenges where you can demonstrate your wares from the bottom up, and the best and the brightest will compete and will celebrate you come the fall. Number 2, if you need some money, the Veterans Administration is actively seeking innovative proposals called the VAI2 Challenge. You go to the www.va.gov/VAI and the number 2. There are $80 million of prize funds available. I should have said this earlier. Thanks for the question. $80 million in prize funds available for the best applications that address the following 4 healthcare concerns. 1, how we leverage wireless technologies to improve care delivery to veterans. 2, how we address the challenges of adverse drug events. 3, what we can do to address those veterans who suffer from polytrauma, which is a very unfortunate truth. And 4th, this is a bit of an odd one, how do we make the kidney dialysis ecosystem more patient-friendly? So you are all welcome to present your ideas.
which leads to my third point. The SHARP program that we funded that I referenced earlier, the Substitutable Medical Applications Framework, the #1 beneficiary of that program are doctors who want to build applications, but their IT department has said, "Doctor, no." This program will allow multiple applications to ride the infrastructure and can sit in parallel. And I got to tell you, I have a lot of physician friends, and every single one of them, because I'm the IT guy, tells me their brilliant idea of how technology is going to improve healthcare. If the Harvard team is successful, which I have every confidence to believe they will, any doctor, any developer who has an idea that can ride on top of a legacy system in a healthcare organization can build that app and have it available in the equivalent of the App Store. Why should there be one medication management application available at your health system? Why not 30? And let the clinicians on the front end choose which one is the best one for them to interact, presuming all of them interact with the systems at hand. That's what we're going to do to inspire physician and nurse innovations.